Hello everyone. My name is Hatan Mortada. I'm a plastic surgery resident based in Saudi Arabia and Riyadh. I'm truly honored here to be presenting about a presentation on the ideas to publications, the fast track to publishing plastic and reconstructive surgery. I would like to thank the Plastic Fella for giving me the opportunity to present today. I'm truly honored. I'm sorry I couldn't attend live. However, I hope this presentation and this recording will be useful for you all. So basically, in the following slides, I'll be presenting about my personal experience in publishing research in plastic surgery, and how to go through it step by step approach. So this is like an overview of the presentation. First, I'll be discussing about why research is actually important in plastic surgery, and how to come up with an idea and reformat your idea as a research question based on the PICO framework. And then I'll be discussing about how to review the literature, then how to choose the appropriate study design based on your study idea, followed by the ethics and the protocol preparation, whether your study needs to be submitted for an IRB or not. Then I'll be discussing about how to write your manuscript based on the IMRAD IMRAD format. Then how to choose the appropriate journal. Lastly, how to submit your paper for the publication. So when it comes to the importance of plastic surgery, research is extremely important in all aspects of medicine, whether it's plastics or even like general surgery, etc. Definitely all the innovations and surgical techniques, as well as the tremendous transformation in each specialty is based on research. So, conducting research and publishing manuscripts, it definitely drives innovations. These new techniques is based on what has been previously published in the literature, and this will definitely lead to enhancing the patient safety and outcome, and reduce the possibility of any complications, and our patients will be even more satisfied with the better outcomes. Later on, the other aspect is that it can definitely boost your career, and especially in if you're a medical student, or if you're a resident of trying to apply for a fellowship, or even if you're a fellowship trying to apply for a position as an attendee, having a research and academic background will definitely promote your CV extremely. Lastly, it will create your academic identity, especially if you're interested in academia. Publishing manuscripts and presenting your work will help you a lot. So, how to come up with the research question? So, basically, research question can be driven from either if you're interested in a specific topic, or based on what has been previously published in the literature. Reading the limitations and the future recommendations in the end of each manuscript can actually spark a lot of ideas that you can come up with. Some of the ideas that I have previously worked on is about the role of tranexamic acid in cleft palate surgery. So I had this idea about whether the use of tranexamic acid is actually effective to reduce the blood loss in cleft palate. So I decided to conduct a systematic review of this project based on the PICO framework. So when I applied the PICO framework, so this is the manuscript that has been published. It was based on patients who underwent cleft palate surgery. We included articles that were specifically examining about the role of tranexamic acid in cleft palate, and assessing about the outcomes, whether they reduce the operative time, or, for example, to reduce the intraoperative bleeding, etc. So when it comes to refining a research question, so, for example, if I would like to have an PICU, I would like to have defining my idea as a research question. So, if it was about like conducting about the role of tranexamic acid in cleft palate. So, as I mentioned, here is the PICU framework. The P, which is cleft palate patients; I, intervention, which is tranexamic acid; comparison of tranexamic acid; O, which is the operative time, complications, etc. So, applying the PICU framework can definitely help you a lot to refine your research question, also like to make it simpler for you and your team mates. So after you have refined your research question, you have to identify the literature, and you have to review the literature, what has been previously published on this topic, and what the literature says. If there are enough background or literature on this topic, you can conduct it as, for example, like a systematic review, or like you would like to do it as an original paper. So it all depends on the research question and the thing that you would like to deliver on. So why it matters? Why reviewing the literature actually matters? First, it avoids repeating the published work if there's any recently published manuscripts about this topic. So it's better to be avoided for repeating the published previously manuscripts. The second is understanding the current evidence. Lastly, if there's actually any gaps in the literature about this topic, will definitely help you to refine your idea even more. So after that, after you have reviewed the literature, you can start now designing your study. So basically, the study can be designed according to your research question and what are the things you're trying to aim for. So, for example, if you're focused on would like to report a specific case of a single case report or a novel technique or like a unique complication, this is considered more of a case report, or if it was like more 2 to 3 patients, it can be considered as a case series. If you're trying to assess a specific prevalence of a specific disease on a specific timing on a snapshot on time, this is considered as a cross-sectional study. If you're going to assess the exposure and follow it up for the outcomes, this is considered as more a prospective cohort study. If you're trying to compare the interventions with a higher rigor, this is considered as RCT. Lastly, if you're trying to summarize multiple studies as a comprehensive analysis of literature, this is more of a systematic review. So after you have chose the right proper study design, according to the study design, some studies designs needs an ethical approval and IRB committee review. So if your study needs an ethical approval, especially if it was, for example, like retrospective cohort, prospective cohort, or RCTs, you need to apply for an IRB. This is according to your institution that you're working or studying in. Usually, the IRB or the study protocol requires multiple elements, including the title of the paper, the background, what's the aim of the study, and the primary and secondary objectives. What's the study design you'll be conducting? Who are the population? What are the variables you're trying to extract, or even the initial analysis plan. So after you're done with your ethical approval, you extracted the data or you gathered the data, and now you are ready for writing the complete manuscript. So complete writing the manuscript is based definitely in the IMRAD format, but it's according to the study design you're working on. But the majority of the different study designs is based on the IMRAD format. So the IMRAD format is considered as a gold standard for scientific writing. This section is actually based on I stands for introduction, and it is about what's known in the literature, what's missing, and what are the aim and the objectives of your study. The M stands for the methods. How did you do the study? How did you collect the data? What are the data that you collect? What was the study? What was the tool that you have collected the data, etc. And then the results. What have you found based on your tables, the figures, and statistics that you'll be doing according to the data extracted and gathered based on your study design. Later on, the discussion, this is more of a section that defines what does your results mean and compared to the literature, and you also critique your findings and what are the limitations you have faced throughout your manuscript. Lastly is the conclusion. So, what's the take-home message of your manuscript, and what are the things that you would recommend for future authors that would like to conduct in this similar topic? Step number 7 is finding the appropriate journal. There are different ways for finding the appropriate journal for your manuscript. You have to keep in mind that who are the audience that you would like to for them to read your manuscript. Are there surgeons, researchers, patients, and then what are the article types accepted? For example, like some journals, they do not accept case report and case series. And in the other, also the other things that you have to keep in mind is that the indexing. Is it really important for you? Like, for example, PubMed or Scopus. And lastly, whether you prefer to publish your manuscript in an open or a closed access journals. One of the best ways you can actually use for identifying an appropriate journal is by using Jane website. You can just insert your title and or abstract, and the website will recommend a couple of journals that you can actually submit your paper to. So after you submit your paper to the manuscript, definitely have to keep in mind that you follow the author's guidelines exactly. Also, you can include the strong cover letter and make sure the referencing format is actually following the author's guideline or the journal's guideline that you would like be submitting to. So, in conclusion, I don't need to be a professor to publish your manuscript. You just need to be a curious, consistent, and a bit of courage. Start where are you where you are for now, with the patients around you, the problems that you are facing, and the ideas that you can come up with. Your voice matters. Your work can shape definitely the future of plastic surgery. So ask, write, share, repeat. The words needs your idea. Just publish your paper. Thank you so much. I hope the presentation was useful. For any questions or any collaborations, you can email me through my email, hatamortada@gmail.com. Also, you can follow me on social media accounts, whether Twitter, Instagram, LinkedIn, or even Research Gate. Thank you so much for your attending and listening to my presentation.